Okay, welcome everyone. We're at the top of the hour. Wherever you are in the world, 9 a.m. here in Vancouver, in Canada. Uh, it's been quite a while since we've been together. So welcome, like I said, welcome. It's nice to have you all here. And today we have a Combra Q&A session. And also, of course, if there's room, you can share experiences if you want to share. Before we get started, I don't know how things are in your area, but just a little, I find it funny story anyway. So we have a patio that's over the kitchen. So it has to be surfaced every 2 years. So we bought the recoating paint surface stuff in April, and you need a window of 3 days of sun, can't get any rain on it for 3 days. And the minimum temperature that can go down to at night is 10 degrees Celsius or 50 degrees Fahrenheit. So from April, uh, we've been watching the weather every day to see what's happening. And just this weekend, we finally had the conditions right to paint it. So I hear lots of stories like that around the world. So I just thought I'd share that. I thought it was quite funny. And yeah, it was good. Good weekend, very nice here. So today what we're going to do, we're going to go through a number of questions to begin with that were sent in ahead of time. And I'm going to field a few, we'll kind of ease into the water today. I'll field a few of just technique ones to begin with. And then Arjan is going to go through some more of the treatment ones. In the meantime, if any questions come up for you today, you can write them in the chat, and once we've gone through the questions, then we'll go through the chat, okay? And or if you prefer, let's say there's a lot to articulate in the question you want to ask, then you can put your name in the chat and say, I'd like to ask a question. And when it comes to you in that order, we'll say, okay, let's say, Alexander, if you're ready to share your question now, please. And then if you turn your mic on, ask your question. Uh, Also, we're looking at about, say, an hour, maybe an hour and a quarter for the meeting, unless there's absolutely still busting with questions. Anyone who'd like to stay, we may go to an hour and a half. We'd like to keep it to an hour and a quarter. And the meeting will be recorded, okay? So you will get a recording, an email will go out supplemental to this video or this webinar with the video recording. And we are intending, just in case I forget at the end, I want to mention it now, we are intending to have another webinar in the autumn. So make sure you check your inbox periodically about that. So let me begin with a treatment technique question. It was sent in, so I'll just read it and then I'll go through it. Is it important to follow the order that the points appear in any given treatment? So for example, I helped my wife on day one of Vitality. This would be Universal 4 or the Vitality treatment, and they're all back treatments. So I help her with the back treatments, and then after I finish these points, she does the remaining points that are on the front. So it's easier for them to do that way. So the question is, can we break the protocol points up that way? Will it reduce the efficacy of the treatment? And the question is, the response is no, won't reduce the efficacy. With chromotherapy, it's going to, as long as you use it, it will work its way into your life. So as part of your lifestyle, we want you and we encourage you to make it work for you. So that means you can do it whatever time of the day, break the treatments up however you need to, in order for it to be, as the question says, that's easier for me. So to make it easy for yourself, because we don't need any additional stress, especially this day and age. So that's one little thing that you can keep note of. You can do the treatments whenever it works for you. Main thing is to do the treatments because the effect of the treatment carries on after, let's say if I'm treating my wrist, when I take the delta away or the palm, the effect continues, okay? This second question comes in from a palm user. And this person says, I'm disappointed in the design of the palm in that if I want to use it to treat my thyroid issues, which involves a lot of points up and down the back, it's almost impossible as there's no handle. So one of the things I would encourage you, the simplest thing, is the palm is very robust. So you can easily take your Cobra palm, okay? I can put it on my back, just put it on the chair and lean back into it. And if I can't put my hand behind my back to place the palm on the chair or a pillow to lean into it, what I can do is I can lay on the sofa, I can lay the Cobra palm down and just lay right in and turn it on and then just lay back into the Cobra palm. You can do that lying or sitting. It's very convenient. You probably fall asleep, which is okay too. Uh, and with that, we have had people say they, tape a spatula onto it, or they use what do you call those, selfie sticks. So you can get innovative to make it work for you, okay? So I hope you won't give up on doing the treatments on your back, just to change things around a bit to make it work for you, okay? And then a question was asked, if the treatment, this one specifically, neurology protocol, doesn't mention using the ultrasound, do I use it or don't I use it? So in the version 5 of the user guide, if it doesn't say anything about the ultrasound, you use the ultrasound, okay? In the previous version V4, you'll notice there's going to be an X through the ultrasound button in specific treatment. So that's pretty straightforward. Now, another question that was sent in, there are universal protocols and or treatment sections instructing to use only once per day or once every second day. So the question is, can I do it more? So we're going to touch on this question again later because Arjan's going to go into some detail that will get into that as he goes through the question or the treatment questions. But what I wanted to say right now is if you have an acute condition, multiple small treatments in a day are going to work good. The user guide is a middle of the road starting point. It means some people will want to do less and other people will want to do more. And of course, the question goes on, can, I overdo it? So we're going to go into that a little bit more, but the simple answer right now is no, okay? And like I said, we'll come back to this question a little bit later because Arjan will flesh some things out now that'll give some more context so when we answer this question, we're not having to do it twice. Okay, so now, Arjan, I'm going to turn it over to you. Arjan is our Director of Research and Development. And so he's got a lot of the technical know-how. I mean, we all do, but Arjan is our in-house specialist in that. So I don't see you on here, Arjan. Are you there? Oh, there you are.
Yeah, I'm here.
Okay, great.
Thank you, Gerd. Good evening. Well, I guess it's good morning for many. Great to see many faces I know and the new people. Welcome to Cobra Therapy. Okay, so we have lots of very interesting questions. All right, so before we jump to the actual questions, I'd like to step back just a couple minutes and I would like to remind you what are we actually doing with Cobra Therapy. With Cobra Therapy, we're not trying to, let's say, destroy a parasite. We're not trying to kill the disease. That's not how Cobra Therapy works. We applying Cobra Therapy to support the body in its own healing. And this is the beauty of Cobra Therapy because remember that you are your best health detective. What I mean by this is that you actually the best person to know the condition of your body. So I will give you some hints how you can develop an awareness, develop understanding where your body needs support and how we can apply Cobra to provide that support. So there are 3, let's say, key areas where we apply the COMRA to the body. First of all, we directly treat the location of injury, pain, or certain disease symptoms. Let's say weakness, nausea, and so on. So you know the area where exactly the problem is at. Let's say, you hit the elbow, you know where the problem is at directly in the elbow. You put the deltoids or the palm over the painful area. So it's easy enough. The second principle, if the problem involves not just one spot, but also a connected organ. So this is the second principle. And the third one is that when a disease involves entire body or entire system, and we add systemic support using universal protocols. And I will go through several examples from your questions, but basically here is the 3 steps in how all of the user guides is organized. All our protocols are a combination of these 3 principal areas: location of injury, connected organs, and systemic support. That's it. It's very simple. Okay, so you got your palm, you got a delta, and let's say you want to treat a condition. How do you choose a protocol? Obviously, the easiest is you open the user guide and you found your condition. It actually listed there. We have, I don't know, maybe more than 300 listed conditions in the user guide. And it's very simple. Start from there. Just open the protocol that lists your condition. But what if the name of your condition or disease is not listed? What if you have several conditions, or you're not sure what exactly you have, and maybe you won't yet diagnosed, and maybe you don't want to go to the doctor, and you want to do already something, and COMRA can help you with that. So in choosing protocol, we are looking again at 3 things. First thing is, where is the problem? The location. And you just do the mental note. Okay, I have a problem here, 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 here. Second, note the characteristics of the problem. Is it local only? Is it spreading? Let's say it's the pain shooting up the arm. So make a mental note of that. Also, when the problem appears, is it all the time? Or maybe it's only during movement, only after having dinner, for example, and so on. So that gives a clue, what are those connected organs? What are the conditions where the problem appears? And the third important question is, for how long I have this problem? Because if the problem is recent, let's say a couple of weeks, maybe a month, not more than that, then the length of treatment most probably will be short. Let's say you will do one course of COMRA for 1 week, maybe a couple of weeks, and the body will regenerate, recover itself. But if the problem is prolonged, if it's a chronic condition, then you should be aiming, and don't forget about this, you should be aiming at several courses. And in chronic degenerative autoimmune conditions, you're looking at many months, sometimes even a few years of that continuous support with COMRA therapy. And I'll give you some example. So at the end of the day, you would be looking at a protocol that is the most similar to your diagnosis, to your problem. It doesn't have to be exactly that. Because what you're looking at is an approach from the user guide how to treat the location of your symptom. And that's the key point. In other words, you don't have to look exactly at these medical terms, at this scientific language, is my disease listed over here? No. If you know for sure that your problem, let's say in the ear, and as I'll show you next, then you can choose pretty much any of the protocols listed for the ear conditions for hearing. If it's in the heart, then go to cardiology section, and so on. So let's say, we have a very good question about tinnitus. In the previous version of the user guide, we had a separate protocol listed for tinnitus. In version 5, we decided to combine it with otorhinolaryngology 6. This is also for Meniere syndrome. But yes, it's a good point. We actually will add back the word itself, tinnitus, in that protocol. But let me give you a bigger picture, because tinnitus is not a disease itself. It's a symptom. It's something when, let's say, you're hearing ringing, some noise, humming. So let's say you notice some problem with your hearing. What do you do with that? Well, depends on why you have hearing problems. Let's say if it's a local infection in the ear, you go to order 3, and it says in the user guide, local infection in the ear. It's simple protocol. If it's a mechanical injury, let's say you had a surgery like tympanoplasty, you go to order 4. If it's a partial loss of hearing, could be many different reasons. It could be, after a loud concert you went to, but not a, major disease, a problem underlining tinnitus. You go to order 5. Now, if you have a long-term hearing problem, you go to order 6, and you will see in the user guide it says plus neurology 1. Why it is so? Because we want to address not only the ear itself, but we also, trying to address the underlying problem. It could be a neurological disorder. Let's say you are recovering after stroke, or maybe due to dementia or any other neurological degenerative conditions. It could be long-term exposure to vibration. Let's say you worked at a factory for a lot of time, or maybe you are a musician, and we have actually very good feedback from musicians. So you want to address not only the local area around the ear, which is order 6, but also neurology 1, which is the entire head and neck area. So, and this is the very simple logic, very simple progression. Even though all of them are about tinnitus, order 3, order 4, order 5, and order 6, there could be many different causes of tinnitus. And the number of points, extent of treatment will obviously, have to correspond. So it should be fairly simple when you go to user guide and you look at those points. It's very simple actually. So hopefully that answers the questions about tinnitus. Okay, we had a question about glaucoma or central retinal vein occlusion. And that's the protocol number neurology 14. We combined under that protocol all the different eye conditions, glaucoma, myopia, all the different conditions under eye diseases. Now here, we also look at the other possible complications. Let's say if you have also high blood pressure, and that contributes to the problem, to glaucoma, then you would do neurology 14 and you would add cardiology 3. Remember that the eyes are not separate from the body. That's the sort of the entire system we're looking at, entire body. If you have some other neurological problems, again, something like stroke, maybe neurodegenerative disease, then you would add neurology 1. That's the treatment with all the points on the head in the cervical area on your neck. If you have a lot of emotional mental stress, you would add universal 7. That's the treatment for the emotional mental stress. And also we actually did a separate webinar on eye conditions. We listed different cases, we gave recommendations. So in the follow-up email, we'll include the link on this webinar. So hopefully it will answer your questions regarding glaucoma. What can you do about it? And just briefly say, My father is using it all the time, last 7 to 8 years. And I believe that's the thing that keeps his eyes working, and he's a painter, so his eyes are his tools. I certainly most recommend this treatment. Okay, let's talk about the question about pain in hands and feet. Can Comra help? How do I treat pain in hands and feet? Again, you switch on your detective mode and you start to investigate. How do you experience this pain? And now, obviously, the question was very short, but now I'm giving you clues. How can you look deeper? Where is the location of the problem? Let's say, now for argument's sake, the pain is only in the fingers. It could be the, let's say, small joints in the hand. It could be damaged tendons in the hand. And you go to Traumatology 8. You will see that that treatment lists the points only on the hand, because we are addressing the local problem only. And you would do treatments for as long as necessary. Keep doing the treatments, until the pain subsides. But let's say, what if the pain is not only in the hand? What if it's, let's say, migrating? It's shooting up the arm all the way to the neck, for example. Well, the chances are, in this case, the pain in the hand is actually due to the pinched nerve. You know that the peripheral nerve starts from the spinal column and goes all the way into the hand. The pinching can happen in many places, at the wrist level, elbow, but most probably it's in the cervical section of the spinal column. So what does it mean? It means that you need to look not so much at the area where you feel the pain, but actually you need to treat the nerve. Now the problem is sits in the nerve itself, because it's being pinched. You go to section neurology, you go to neurology 2, and when you open the protocol neurology 2, you will see an example how you treat a pinched nerve. Well, in that example, exact protocol, you will see a pinched sciatic nerve that goes in the leg. But approach would be the same. In other words, same frequency, same time, and you would select a number of points up the arm from the hand all the way to the cervical area of the spine. You scan those areas in the spine because you want to treat the nerve itself all the way up to the root of the nerve, and that's neurology 2. Let's extend our exploration. What if the problem is the painful area is not only in the hand but also in the feet? Okay, one possibility is that the problem is the entire spinal column. Something like degenerative disc disease, and I'll have a slide later about that. Now, when we have problem with the entire spinal column, you go to Traumatology 1. That's the comprehensive treatment with the points throughout the entire spine. Why it's important is because, yes, we need neurology 2. In other words, we do need to treat the pinched nerves in the legs, in the arms, but we also need to treat to support the regeneration of the spinal column, tendons and ligaments and muscles and the cartilage, the bone structure, the entire structure that holds the torso of your body. And you can do that with Comra therapy. Next possibility, it could be a nervous system damage, something like multiple sclerosis. And obviously you might go to a specialist to identify it, if it's indeed the case. But if that's the case, you do neurology 10. We have a separate protocol specifically designed for multiple sclerosis. Another possibility is autoimmune damage. It's inflammation throughout the body. Then you go to the immunology section and you pick the protocol which is again most applicable to your condition, or maybe your condition is listed there actually. Another possibility is diabetes. In this case, you would do endocrinology to treat diabetes itself, the disease, the condition, the pancreas. Plus, you would be doing neurology 15, which is diabetic polyneuropathy. You see? So, again, the logic is very simple. You start treating locally. If the problem wouldn't go away, let's say after 2 weeks, of diligent treatments, it's not going away. Well, perhaps something else is involved, and you start to investigate. Is the pinched nerve? Maybe you have high blood sugar. Maybe it's damage to the nervous system. And as you go and you add more points, they're like layer after layer. Okay, hopefully we answered that question. Yes, I would like to show you this slide because there were several questions about cartilage. Is it possible to regenerate cartilage? Usually it's due to arthritis in the knee, something like a degenerative disc disease. Yes, it is possible. Normally, we see symptomatic relief, meaning the pain becomes less, range of motion is improved already after 2, 4, sometimes 6 weeks of treatments. The improvement is very remarkable. You can actually feel how your range of motion is improved. The joints are not so painful. Maybe pain sometimes disappear completely. But on the MRI, you will see changes much later. So in other words, it is possible to regenerate the damaged cartilage, or in this case, degenerated disc. It is possible. But remember, it takes time. Because Comber therapy is not an invasive procedure, it's not a surgical procedure. It only very gently supports regenerative process. And on this picture, you see an example I found in the literature. It talks about laser therapy, but still, it shows you how the disc between L4 and L5 start to gain density. You can see it becomes whiter over here. Especially after 5 years, you can see, it's halfway back to the normal density. It becomes much whiter. So it has been confirmed on a number of cases, but we know with Comber therapy, we achieve results much faster. I would say at least 2 to 3 times faster than only with laser therapy. So by all means, apply Comber therapy to treat any degenerative conditions. And yes, sometimes it's you have a very late stage arthritis. They call it bone and bone, or a very elderly person, 80 plus, 90 plus. In this case, Comber therapy may not necessarily reverse the degenerative process, but at least we can stabilize the condition. At least we can symptomatically improve quality of life. It's not so much painful. The person can move, get up and down. Much more quality of life, even though we may not necessarily talk about regenerating the actual tissue. It all depends on how much the body still have the so-called functional reserve to rebuild itself. But with Comber, we support this process. Okay, there was a question about...
If I may add to Arjan.
Sure.
One thing with when you look at, let's say, degenerative disc disease or these really long-term things, the big thing that comes through all the studies and obviously practical experience is staying with it. And that's part of why I said at the beginning, Comber therapy works its way into your life. And so you make it work for you. In that first question, we talked about breaking up the protocol points, because that's a big difference in the way people generally think of healing or whatever. It's just, I have this goal to get through this, and then I'm going to stop and just carry on with my life. Whereas we're saying, no, work this into your life, because then not only can you deal with the shorter term things, but you can deal with the longer term things and prevent those from occurring by making that part of your lifestyle. I don't mean constantly treating, but so that chromotherapy is a part of your life. Because let's say in this study here, for example, the main difference they found is people would give up. They'd feel better, which is great. So they got through that initial goal, but they wouldn't stay with it. And only the people who stayed with it were the ones who had the results of, let's say, in this case, after 5 years, the disc being regenerated. So there's a lot of a change of thinking or change of point of view, let's say, with respect to it. So I just wanted to mention that, Arjan. Thank you.
Thank you, Gerd. One point you gave me sort of a breathing space, I recalled, very important. If you have a problem, let's say in the lumbar area, and somebody told you have a protrusion, you have a slip disc and so on, you're doing the treatments, remember that the spinal column is one entire fully connected system. In other words, you do need to do traumatology 1 in its entirety. Because if you have problem in lumbar area, most probably you have problem in cervical and vice versa. So it's important to treat the entire apparatus, the bone, the cartilage, the tendons, the muscles, everything that holds it together at full length. It's a very important point. But also, Garrett, I saw somebody raise the hand. Charles, was it you?
Yeah, Charles raised his hand. Go ahead, Charles, please.
Just following on from that, I happened to be speaking to a doctor this week, and she mentioned that she had had very good success with meniscus tears and even able to avoid surgery. So that was something she'd never volunteered before, but it shows what can be done.
Fantastic. Thank you, Charles.
Maybe Arjan, just unpack a little bit meniscus tear for people that don't know what that is. Yeah.
Well, the knee is probably one of the most complicated joints in the body, and whenever we damage the knee, it's a very complicated tissue. It's the cartilage, it's the tendons that hold it together, it's the capsule that holds it all together, and sometimes the tear is so bad you have to do the surgery. And again, chromotherapy is a completely non-invasive procedure, and as Charles said, doctors have good results with it. Well, I have my problems with the knees after doing sports in youth. It took me about maybe 8 months to restore the knee, and since last 8 years, I don't have any problems. Okay, so move on. We had questions about how to treat orchitis. There's a protocol, it's called Nephrology 1. So if it's a local inflammation only, orchitis is inflammation of the testicles, you do Nephrology 1. It lists all the points, it's fairly straightforward protocol. But I must add, if it's a part of a wider inflammatory process, if there are signs of systemic inflammation, you also need to combine it with something like Immunology 1. So I'm just giving you this hint, again, not to look only at one organ and address it there, not only, but if there are signs of other inflammation in the body, think wider. So, but as far as orchitis goes, it's a very straightforward protocol. Cholesterol. Can we, support the body? What can we do when it comes to high cholesterol? We have very good, consistent results with reducing your cholesterol, and you are aiming at treating the liver. If there are no significant diseases involved, diseases of the liver, typically we see that after the first month of treatment, cholesterol drops at least by 30% or down to normal values. Obviously, there is a range, variation between different people. But after the first month, shows very well how liver can regenerate itself. With chromotherapy, it does fantastic work in normalizing levels of cholesterol, and that's without any medication, without drugs. I must add, you do gastroenterology 1, but also you need to adjust diet. It goes hand in hand. Now, if there are complications in the liver, like fatty liver disease and so on, it takes longer. You do more courses of treatments. And, our current estimate, we would say it requires about 6 months of continuous treatments. You do not take the break, but keep going with the treatments. Until the liver can function normally and restore the homeostasis, including cholesterol levels. But so far, we've been seeing quite consistent results when it comes to cholesterol. So, hopefully it answers the question. Okay, big question of concern, obviously, is post-vaccine injury. How do we approach the treatment of post-vaccine injury? And I'm mostly talking about now Pfizer and Moderna vaccine, talking about COVID-19, obviously. The approach, again, coming back to the basics. Think about the location. First of all, the location. If the problem is, let's say, in some sort of inflammation is localized in certain area, or let's say one organ, then you would treat that organ as if it has a disease. If you have heart inflammation, pericarditis, or something like that, you would go to cardiology section, you choose cardiology 1, for example, and you apply that protocol. If you have problems with, let's say, memory, with thinking, you have dizzy head, you go to neurology 1, which is, again, remember, the protocol for the head. If you have problem with your kidneys after vaccine, go to I forgot what's the protocol for the kidneys, but anyway, it's listed in user guide. And you continue doing the treatments until symptoms persist. That's important point here. You do not stop the treatments, as the user guide says, 2 weeks treatment, 2 weeks rest. No, you need to continue doing the treatments while the symptoms persist. Once you have cleared the symptoms, your job not done yet, because remember, the damage could be extensive due to vaccines. So you need to continue supportive treatments, let's say after a break, took a 1 month break, and then you repeat the courses up to 1 year. Because remember, we're aiming at regenerating the organ. We need to repair the damaged tissue. It takes time. Now, if the post-vaccine injury has systemic nature, you have inflammation all over the body, the pain is migrating all over the body, you have weakness, extensive weakness, and so on, then you are going to use Immunology 1. That's the most extensive protocol that we have for chromotherapy. And with this protocol, we address autoimmune conditions and also systemic inflammations due to post-vaccine injury. And there was a comment about, is there any danger due to magnetic field in coma? No, there is no danger whatsoever. So just feel free, and I most encourage you to use chromotherapy to treat this type of injuries, this type of inflammation. I wish we can just bring this message to as wide as possible, because I know there are so many people now suffering from those vaccines.
Arjan, I wanted to mention too, one thing with this, because it's generally inflammation, the body's in a inflammatory state, so became very conservatively with the treatments. because when the body is in an inflammatory state, when we add energy into it, if we add too much, then the inflammation can get exacerbated. So you'll notice at the beginning of the user guide, in the before you start section, we talk about how Calmer therapy works, where you can have, the body kind of rallies its resources to tackle a problem, and things can feel worse for a time before they feel better. So to make that a less bumpy ride, we say start very conservatively in those inflammatory conditions, whether they're local or systemic. And that applies to more than just post-vaccine injury in those inflammatory conditions. To start very conservatively and work your way up. And if you're wondering or you have any questions about that, the Calmer Wellness Test is a really good place to start to give you a ballpark of, where am I at? And if you need any support with that or treatments, obviously we're here. But yeah, just conservative start is the main thing in our experience. Yeah.
Yeah, thank you, Garrett. I have a slide later on, when I'll go through, how do you gauge that progress, especially when you have a severe, acute, chronic condition. Okay, so this is a bigger slide I have. Somebody asked about thyroid. Basically, the question is, how do we approach treating thyroid issues? And if you go to user guide, obviously you will see the treatment protocols in the immunology section. It's straightforward. Again, just start doing the treatments. But what I would like to show you is an example of progression in time and how we vary and combine different protocols depending on the condition of the person. So here in Russia, we have this patient of Dr. Anna, and she's working with this female. She's 43. And she was recently, when she began Calmer therapy, that was about 2 years ago, she was recently diagnosed with autoimmune thyroiditis. Now she had a very extensive history of chronic inflammation in the body. It was already exhausted. She had inflammation of skin, erysipelas. She had parasitic infection, toxoplasmosis. She was recovering after COVID-19, and the biggest sort of taxing on her body was that she was 3 years after an oncological disease. So her condition was, let's say, her thyroid had to work double, overworked. It was hugely overworked because of that chronic inflammatory load on the whole system. So in other words, if you think about the condition of this person, it's not only the problem of thyroid itself, it's the consequence of having for many, many years immune load on the system. So that's what we did. She started with Calmer Delta 905, and because she was recently diagnosed with thyroiditis, she wasn't on any medication yet, no hormones for the thyroid. So she used only Calmer Delta 905 at the time. So she started with Immunology 1. That's the comprehensive treatment for the entire body. She did local treatment for the skin where there was a lot of inflammation, and she did it for 3 weeks, non-stop, every day. It's a very long protocol. It's almost 2 hours, if I'm not mistaken. Now, then she took 2-week rest, continued Immunology 4. Now, that's a treatment more localized directly on the thyroid, plus local skin inflammation treatments. She also had very good herbs, micronutrients, quite relaxed diet, and she did work on the emotions. She had a lot of emotional stress in her life. And we saw very good progress of her condition. I skip all the details, but basically, after the first year, her erysipelas was nearly completely healed. There was only some patches left. Her body temperature was feverish all the time before, all the time. Now it was normal most of the time, and her chronic inflammation got under control. So that's what we could achieve during the first year of Comra plus herbs, diet, micronutrients. Now, in the second year, she could relax quite a lot her Comra protocol. She didn't do as much. She reduced immunology 1 and 4, and she did it not in courses. You remember what we discussed here, for 3 weeks, 2 weeks rest, and then another 3 weeks. Here she did it immunology 1 and 4 only once per 3 months. So much more relaxed Comra protocol. Then she also added later on Comra for liver and digestive tract. She was on much stricter diet though, and Dr. Anna also added periods of fasting. So after 2 years of this protocol, all her blood test parameters were in normal range, and there were no sign of chronic inflammation. Obviously, she will continue. Dr. Anna keeps working with her. She will continue because remember, she had it for many, many years. Her exhaustion due to inflammation, thyroiditis, cancer, COVID-19, all of this lumped together. So that's why, she will continue doing it. But so far, she had very good results, and she was so inspired and very happy. So, to remind you, this is a thyroid, someone who was recently diagnosed and not yet on medication and hormones. Somebody who had thyroiditis for many years, then in this case you would have to prolong the intensive treatment protocol, not just 1 year, but maybe more. Okay, so that's thyroid, how we approached in our practice here treating this condition.
And also to mention part of why Jean brought the detail here is just to show that stay in the course again, where you start, you have a goal, but then it's not like overnight you're taking a pill and then everything's gone, it's back to normal. It's this change of lifestyle, change of attitude, change of perspective, in that it's not just about the symptoms being gone. It's like, well, how well can I get? Like, there's no ceiling to wellness. I bring that up often, and changing that mode of looking at that. So yeah, I just wanted to mention that, Arjan. Just we wanted to go from the simple to the more involved and give you an example. Okay, thanks.
Yeah. And whenever we talk about chronic condition, endocrine condition, autoimmune condition, you have to think holistically. You need to address the condition. You need to really learn from your body. Listen very carefully what it says to you and adjust treatment. It's really learning how to listen to the body. And the user guide is there to give you an example how to start your path, on healing, but then you adjust it. And it's actually, very straightforward. You get it naturally. You feel, it's been 1 week of rest, I do need to resume my treatments. I'm feeling down. And you do that because the body tells you, listen, I need support, So cut your break shorter, resume your treatment protocol. Okay, so I'll move on from thyroid. Hopefully, we gave you an example. Now, there is just before we started this webinar, we got several questions on cancer. Now, obviously, there's a whole range of different possibilities when we're talking about oncological diseases. So I will keep this very short, and I'll give you general guidelines how to think about cancer. The key point is that Comra does not destroy tumor. It does not kill the cancerous cells. No. What Comra does, it supports the natural anti-tumor immunity of your body. That's what Comra is doing. And you need to think about how to treat cancer in terms of how to support the body the best. when we provide that support, our natural immune defenses, which are working every day anyway, they would be engaged, they would work at full capacity to naturally eliminate, to push out, or actually destroy the tumor. Now, step number one, when we approach, again, a condition, someone who had diagnosed with cancer, and most frequently we see people like that who are already exhausted, they are tired, and our first priority is to stabilize the condition. We need to stabilize the condition. We need to support the key organs that keep, the body working. So you'll be looking towards universal protocols. That's the Unit 3 when you treat the blood. That's Unit 5. So this is the first goal, and we start conservatively. If you have palm, for example, fantastic, go with it, because at the first stage, we're looking at only at the most gentle support for the body to stabilize its condition. Secondly, sometimes you already have had chemo, radiation therapy. Let's say you're recovering after surgery, which is related to the cancer. Again, even before we start thinking about tumor, our first priority is to support the body. So we would be applying Comra locally, let's say where you had surgery, or where you have tissue damage due to radiation therapy. You'll be working with kidneys and liver if you had chemo. And we had very good results when Comra was combined with chemo. Not the best, not the first choice I would recommend, but some people do go this way. And we know that when you do Comra before the invasive procedure, during and after, the body will recuperate and recover much faster. Second step is to gradually rebuild body's systemic resources. It's not something you would do like specifically, now I need to rebuild body systemic resources. No, it's the natural step. Once you see that your condition is stabilizing, you keep doing those treatments and you start feeling better. And again, this is regardless of the stage of cancer, stage 1, stage 4. We see people getting much better quality of sleep. They'd have much better appetite. The pain would be much less during the first month of treatment. And again, even the palm does fantastic job at this stage. I was truly surprised, but it works really, really good. Because remember, we are giving the body that much needed break. I can rest finally, I can relax, I can digest some food. The body goes into the sleep and recovery mode. Once we build some resources, the body automatically, without any sort of external push, will engage the natural anti-tumor immunity at fuller capacity. And this is, if you open Oncology 1 protocol, Oncology 2 and 3, this is how we approach treating the tumor. We support the body systemically. Let's say inside the protocol there's listed Unit 3, Unit 5, plus locally you will be treating the tumor directly. Again, you would be easing into the treatments gradually. If you have only Delta 905, then let's say you start with 10 seconds over the tumor, 20 seconds over the tumor during the first week, maybe even 2 weeks. If you have Palm or Comra Delta 980, then you would be building up also up to the 905. Now, this is the general outline I'm showing. Obviously, there are a full range of different types of cancer, a range of condition of the person, but that's your general sort of strategic picture how you'd approach it. Yeah. Current, I think at this point, I'll stop sharing.
Okay, yeah, that's great, Arjan. Thank you. We're almost at the hour. We've been answering a few questions in the chat while you've been speaking. So there are still some questions we didn't get to that came in the last minute. So I'm going to touch on a couple of those, and then we will go to if anybody has more questions in the chat. So let me just go there. Sorry, I'm kind of multitasking. Okay. So one question that came in last minute is, I have a tumor on the neck. What level and how long do I set the time? Also, do I move it over the mass? So it wasn't clear what kind of tumor. Could be benign, could be malignant, it could be, say, a tumor, but it's actually a cyst. But regardless, the place to start is, as Arjan has been laying out there, locally. If it's very close to the skin, then you're going to use the 1,000 and the 50. If it's deeper in, then you're going to use the 50 and the 5. You don't need to move it over the mass. You could just put it right on, okay? So we'll just leave it there. If you have more questions that doesn't cover it, do write us, all right? Now, we had a couple of questions with respect to how long, and there's one in the chat too. You know, I want to treat let me just condense it. I want to treat my dry eyes every hour. Can I do that? So generally speaking, what you're going to want to do, and Olivia, you asked that question there, and this was also asked in the question sent in, so that's why I'm answering the chat in case anybody thinks I'm jumping ahead. If you're going to increase the increment of the treatments, in other words, instead of once a day, you're going to do twice a day or whatever, then drop the duration of the time per treatment point, okay? At a certain point, if you think about it, when you fill a glass, once the glass is full, then you're just wasting your time. So you want to give the treatments time to have effect. However, if you have an acute condition, let's say you're having dry eye episodes or continuous, and you're finding that effective with your palm, then go ahead. But remember, if you're going to increase the amount of times you do it, then decrease the time you do it each time, okay? And that gets into a lot of the things with respect to how much can I do. You're not going to hurt yourself with chromotherapy, all right? Okay, and now I have a Chroma Wave pendant question. And it's okay, I'll just read it. It sounds great, but how do we know carrying it on our bodies will give us the imprint of the harmonic effect? Just like lots of products out there claim to be working. So then what I would say is that there's no replacement for experience. We have lots of people who've been using it for a long time who report that makes a big difference in their lives. However, not everyone is, let's say, sensitive to the effect directly. Some people may notice that they have better sleep or they're more relaxed. Other people don't notice anything. I have people that say they don't leave home without it. It's in their pocket or on their person all the time. And then, you know, people say, is it just like any other product? I said, no. You can go to our research section to look at this, let's say, standard scientific tests that show the effects that it has on water. And our bodies are, by population, 99% water, by ratios, it's like 2/3, 3/4 water. So water is a big component of the body. And just to touch on it, when you get into how the water works in the body, it's the biggest player more than anything else in the body. It's doing the most. So we want to support that process. And that's what Chroma Wave, pendant, coaster, and badge do, okay? And then the question, if I want to work on several issues, how can I do that without overdoing treatments? Oh, it kind of jumped around. So Arjan touched on that quite a lot, went through that in the slides. So I think we touched on that. And then we had a few questions with respect to not exactly treatment, but questions related to COMRA. So I'm going to leave those till the end because we want to get to the treatment questions first. And So we'll start with the chat. And okay, skin inflammation, any protocol. So dermatology 1 was mentioned for that. And then can Comra help with gut health? Absolutely. I mean, remarkable results. Yeah, with SIBO, Candida, all of those things. Obviously, you still have to do things with diet and stuff, but with Comra, it's going to increase that speed of healing, to increase the speed of regeneration, the efficiency of it. So by all means, and there's a big gastroenterology, in other words, gut section in the user guide. So go there, start out. There's small intestine, large intestine, liver, all the different parts are in there, okay? And then regarding long haulers, so I don't know if you mean long haul truckers or long haul COVID. I'm going to assume the second. If it's long haul truckers, take it with you. You can definitely do the treatments while you're driving down the road, especially with these new automatic big rigs.
She said she wants to.
I'd like to speak. Okay, so Candace, can you unmute yourself?
Yes. Hi. Can you hear me?
Yes, please go ahead.
Yeah, the question about it's COVID long haulers for me. And my husband and I have had it since 2020, before they even knew COVID was in existence. I got through it, my husband and I got through it through, actually June worked with us. And basically we're still having a lot of the same symptoms. Uh, Exhaustion, no stamina, brain fog, no appetite, no sleep, can't sleep. Mind goes from one thing to the next, jumps to inflammation of the body, chemical sensitivity. Mine's all over the place. Initially, we worked with 3 and 5 and 4, then went on to the cleanse of the liver, colon, dietary. We changed all our dietary habits. Nothing has seemed to bring us out of this acute state. Any ideas on what to add, where to go from here with people this far out with long haul?
Did you do the treatments with Comra as an user guide, as in, let's say, 2 weeks on, 2 weeks off? How would you?
Yes, yes, we did. And June, you can jump in if you have anything to add on this. But I did more of the 2 weeks on, 2 weeks off. Felt some stability, not a lot. Let it go for another couple of weeks. Did it the same thing again, same protocols again. Then went to, under guidance of June, we went to cleanse and detoxification of the liver, colon, kidneys. Did it 3 times, the cleanse, nothing's changed.
What device do you have?
I have the Palm.
The Palm.
Yes.
Well, one example you saw was thyroid, which I covered in the slide. Basically, when we talk about a chronic condition, when we talk about long-term stress on the body, as in your case, it would be long COVID, please do consider Delta 9 of 5, because it has, in this case specifically, because you have a long-term exhaustion of your body, then please consider Delta 9 of 5.
Okay.
My guess at this point, that's what you need. Palm is a very gentle device. It will ease you into Comra, but in your case, it may not be sufficient to have your body to regenerate, to recover, to recuperate.
Okay.
Basically, any chronic condition which involves, let's say, more than 2 or 3 months of history, think about Comra, Delta, and think about Delta 9 or 5, actually.
Okay. Basically been using the same treatments, but with the Delta, correct?
You'll be following the same logic, exactly. We did the Immunology 8 protocol, that's the long COVID, but it's the same what you said in June, fantastic job. It's universal protocols. It's your liver, that's your kidneys. You will see it's immunology 8, and you'll be doing the same protocols. My addition would be at first do not take the breaks, as in continue, let's say, non-stop 3 weeks, 4 weeks, until you do feel significant improvement. You need to get over the first bump, get over the first hill with Comra. So do non-stop treatments. Keep doing, and only after you start feeling, okay, I'm actually feeling better now, then you take the first break. But even then, the first break could be quite short. It could be only 4 or 5 days, and you start to feel down again. Resume the treatment. You see? And then the second break could be longer. So you need to follow actually your feeling. You need to follow the state of your body rather than the book, because the book gives you only a suggestion. But in your case, you do need much longer treatment course and much shorter breaks, especially in the beginning.
Can I ask a question? Have you heard of people like us being this far out, being this ill with post-COVID?
Garrett, maybe you, because here in Russia, we don't have those vaccines.
Why I'm asking is,
no.
could we be addressing something else that's happening in our, in our environment or whatever? Maybe it's not long COVID, but it happened right after. And I just got over the second COVID 10 days ago. So,
Right.
Mm.
Are there any changes in your environment? I mean, let's say, for example, some people are electrosensitive. If a mobile phone tower went up around the corner, that can have an effect. I'm sure, June, you went over all this stuff.
yeah, we're doing
Yeah.
what we can to protect our home.
Yeah.
Air quality, we've changed up with the state-of-the-art purifiers in our home system. We're trying to do what we can if there is anything like that happening. Nothing has really changed on that.
Yeah, I haven't seen any, let's say, that long haulers. Yeah. At the same time, I mean, well, there is something in the chat, but what I was going to say, and I hope this won't be in bad taste, but life maybe wants you to slow down a bit because you're having to slow down. So how do you feel about accepting the process? I don't mean like accept and not do anything with it, but accept in terms of rather than trying to get past it, to embrace it and then go through, let's say, the steps to go through. I'm not saying you didn't do that. I'm just putting it out there. Yeah.
But Garrett, I do understand that, and I embrace that because I feel that.
Okay,
And,
great.
and on a daily basis, I don't let it consume me, but I'm always reaching out or looking at what can we do more that, without being consumed with it.
Of course, yeah.
I do understand that, and when it resonated with me right away what you were saying.
Okay. Yeah. Especially when something goes on long term, it's very challenging. Yeah.
When two of us are in the same home.
Absolutely. So I do recommend, consider Delta 905.
Okay.
Follow the protocol.
Okay.
Just let us know. Reach out. We're here.
And how do I do that? Because I've never reached out. I didn't even know there were questions ahead of. I hadn't heard from you in a long time, so I don't know if it's an email issue with me, but I haven't heard from you, and I didn't think there was anything going on. But how do I reach out? Who do I reach out to? Garrett, to reach out to you first? Okay.
Yeah.
All right.
Yeah, you and June and I, we can chat things through.
Please, yes. Thank you.
Okay.
Thank you very much.
You're welcome. Patrick, I'll just read what you said. In my view, long haul COVID can be persistent COVID or reactivation of something previously dormant. Lyme, co-infections, viruses, retroviruses. So this is an aspect as well that it can be, yeah. And then, yeah, there's another comment in there from Mariette about a doctor. So you can read that in the chat. What else do we have? Okay, so there's no more questions in the chat. We're just about at the 1/4 hour. So I'm very briefly going to touch on a few just generally related things and then a little bit of a hint on an update that, yeah. So there was a question about will notifications on the Comer platform site be enabled again soon? Malen, can you respond to that very briefly, please? We just have a little bit of time.
Briefly, we will know by the end of the summer. We will be doing some experiments. It's very tough issue technologically, but I hope we'll make it out, but cannot promise. So I will let you know.
Thank you, Malen. Yeah. And Maxime, there's a question about the chat, if you don't mind to respond. There was a question about clients mentioned that questions asked on the website have not been answered. Is that, yeah, so if you could just respond to that about how that works, just so people understand if they ask a question on the chat.
Gotta just basically when you ask question on the chat on our website, it gives you after, let's say, 30 seconds possibility to leave email. Generally, people are there 24/7, but sometimes busy with some other requests. So simple way is to leave in that form email, or another way is to come to this same website and check the chat again. So sometimes question may be answered after 10 minutes or 20 minutes later, and the history will still be there on the website in your browser, in the same, if you use the same browser and the same website.
Thank you, Maxine. And okay, I'll handle this. The last one is kind of a hot potato, so I'll handle that one. It'd be nice to receive an update and perspective from people directly affected by the European war. So why I say hot potato is because it's a very easy issue for people to polarize on, okay? And the polarization can be very, let's say, not beneficial to healing because it creates a stress in the body to really get into a certain polarity. So we don't want to go into that, but we're very happy. Please write into anybody at Radiant Life Technologies who you'd like to check in with, and definitely anybody you want to speak to will respond to you directly. But yeah, when it comes to healing, we don't want to polarize to one side or the other or get involved in that discussion. And not that that was the nature of the question, but we just want to handle it carefully so it doesn't go to anywhere political. So I'm going to stop there. There's one other thing with respect to this fall. As I said, we are intending to have another Comer webinar. And also this fall, we are intending an update on the Comer Palm. So keep abreast of your emails, and we will have some updates there for you. And if you want to share those with your friends when you get the updates, by all means. If you know anybody you're talking to them, they wanted to attend the webinar, but they didn't receive the notification, let us know so we can keep in touch with them, or just pass along whatever you get from us. You can forward it to other people, by all means. If your questions haven't been covered fully today, or you'd like to explore them in more detail than we've touched on here, get in touch with us. And I'm just checking the chat, make sure. Yeah, we'll leave the chat for now. Like I said, get in touch with us if you'd like to discuss anything in more detail. I know there'll be more questions that come up, so you can always write your questions down and send them in, and we will go over them with you. So from my side, I don't have anything to add. Anybody from RLT, did you have anything to add before we finish the call? No? Okay. Well, thank you very much for attending, everyone. Yes, please go ahead.
Gareth, was not clear for which question you're talking about. You were explaining the things, but I don't think whether it was clear.
The question.
read
Oh,
it.
so the
Yes.
question was asked. You mean with the hot potato?
Yes, yes.
Yes.
Not sure
It
that
would be,
everyone saw the question.
okay, so the question was asked. Thank you, Anik. It would be very nice to receive an update and perspective from people directly affected by the European war. So that was the question that I was responding to, just so that's clear. Anything to add there, Anik?
Yeah, I cannot only because our manager of our company is Maxim. He's like having this function, and he's from Ukraine. Our director of research and development, Arjan, is from Russia, so we can work together. I know that we have completely different experience. However, if you have to know or really interested to know, please contact them separately and they can answer you in terms of what the situation, if you're really interested into the actual issue and how it unfolds.
Thank you.
To answer to that question, yeah.
Yeah, okay, great. Thank you. Okay, everybody. Yeah, I just checked the chat. Looks pretty clear. So thank you very much, and we'll look forward to seeing you again next time. Okay, bye for now.
Thanks for joining. Bye-bye.
Bye-bye.
Bye.